Cancer is the third leading cause of death in the country, and lung cancer is the most common. Based on a study by the World Health Organization in 2018, lung cancer deaths reached more than 10,000. In fact, smoking cigarettes is the single biggest risk for it. Here on MedTalk Health Talk, we'll discuss the relationship between smoking and lung health, tips to prevent it, and the treatments available. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk on CNN Philippines. Lung cancer is the leading cause of cancer-related mortality around the world. But with proper awareness and prevention, we can work towards reducing lung cancer diagnosis here at home. Our guests are here today to guide us in this discussion. With us is Dr. Ralph L.V. Villalobos. He's an interventional pulmonologist and consultant at the Philippine General Hospital and St. Luke's Medical Center at the Global City. Also with us is Dr. Christine Chavez, our guest expert from Health Justice Philippines. And she's also an interventional pulmonologist and consultant at the Medical City. Thank you both for joining us on the program. Now, lung cancer occurs when cancer forms in the tissues of the lungs, usually in the cells that line the air passages. I'll start first with Dr. Ralph. Can you tell us more about this, Dr. Ralph? What happens when someone has lung cancer?
Lung cancer is a problem when your cells in the lungs, usually it's the airway or in your lung tissue, it undergoes a transformation. It becomes malignant. And ang nangyayari ho doon is that it transforms into malignant cells, and then it grows and grows in the part of your lung. And then if that happens, the oxygen support of your body is decreased. And the most important thing is that lung cancer easily spreads to other parts of the body. It can spread to the bone, to the brain. And sometimes this is the one that causes much problems. No?
There are actually many factors that can cause a change or a mutation in the lungs to happen. And it can happen when people breathe in any dangerous or toxic substances, even if you were exposed to these several years ago. Dr. Ralph, what are the potential causes of lung cancer aside from smoking, and how does exposure to these toxic substances harm the lungs?
So first of all, I have to emphasize that this is really cigarette smoking that is the most established cause of lung cancer. No? So a majority of our cancer patients are smokers or have smoked previously.
But ultimately, smoking is still the leading cause of lung cancer. About 80% of lung cancer deaths are caused by smoking. But until today, many still believe that there is no link between smoking and lung cancer. Dr. Tin, can you debunk this myth for us?
Majority ng mga nakikita naming mga pasyente sa clinic at sa ospital naninigarilyo. So, it's written on the books and it's also proven. So what happens kasi there is really a link between smoking and lung cancer because in the smoke there are two types, the combustible and the non-combustible, yung mga nasinusunog, yung conventional cigarette, at saka yung mga bagong forms. That's a foreign body. So yung smoke na yon plus yung substance itself na nandun sa loob ng cigarette smoke can cause yung mga cells, natural cells sa body na mag-transform at pwedeng mag-grow into a malignant condition.
There are studies now that show that electronic cigarettes or yung tinatawag na vapes are on the rise. Are there harmful effects of electronic cigarettes on the lungs? Do we already have data that can show this or debunk this? Do they also have these carcinogenic chemicals that are present in regular cigarettes?
We are not here to judge smokers or the ones who vape or the ones who find ways to make smoking safer, because there is a reason for smokers why they smoke, maybe a form of stress release. But the fact is, even in the non-combustible, yung mga hindi sinusunog na sigarilyo like yung vape, yung nagpo-produce ka lang ng vapor, there are studies that have shown that pag kinumpare mo yung mga hindi nagsusmoke, never nag-smoke ng vape, doon sa nag-smoke ng vape, mas mataas yung chance na mag-develop ng lung diseases and also other diseases of the other organ systems like sa heart, sa brain. Ang tinanggal mo lang kasi sa vaping is yung pagsusunog. But yung ginamit na substance or carrier nung vape, those substances, kahit vegetable product siya or vitamins siya, when you inhale it in your lungs, it can damage your lungs.
Both cigarettes and e-cigs still contain dangerous chemicals which make them harmful to someone's body. And many underestimate the harmful effects of secondhand smoke. Doc Ralph, what is secondhand smoke and how does this negatively affect the health of those around who are actually smoking?
Secondhand smoke is, by the word itself, yung smoke ng ibang tao, hindi ikaw yung mismo nagsismoke, but you inhale. So it's like passive smoking. So it's like, kunyari, the best example there is you have a family member, like a father or parents who smoke. It's a lot related to lung problems, especially COPD and asthma and some allergic diseases. And their associations with secondhand or passive smoking actually to lung cancer as well.
Because secondhand smoke continues to affect millions of children each year. So a reminder to our viewers, if you can't stop smoking, think about those around you. Smoking around them puts them at risk of lung diseases. Now, while smoking is the leading cause of lung cancer, the U.S. health officials say that smokers are 15 to 30 times more likely to get lung cancer than non-smokers. Dr. Ralph, can you tell us more about some of these risk factors?
Aside from cigarette smoking, right now, we see a lot of non-smokers who have lung cancer. So these are usually young females, mga healthy living, but these are based on the genes. No? So their susceptibility to having cancer is based on their genes and to some environmental factors. Some say that air pollution can be a cause of lung cancer. Some say that burning of fossil fuels like gases and then yung mga pagsusunog ng mga biomass fuels, yung mga uling, some of these in the province, ganun yung risk factor na nakukuha namin. Of course, there are chemicals that are associated with lung cancer. Sa iba naman, it is their work that is making them susceptible to lung cancer. Yung mga seaman or yung mga exposed sa industrial work, asbestos especially, some of them are really susceptible to lung cancer.
Some of the factors, as I mentioned, cannot be changed, such as your family history, your sex. These cannot be controlled, even air pollution. My question now is for Dr. Tin. Does the increased air pollution, especially in metropolitan cities here in our country, make one more vulnerable to lung cancer? Itong mga nagko-commute, are these types of chemicals that are found in air pollution enough for one to be at risk of lung cancer?
Aside from yung nasa katawan na talaga, yung nasa genes, nasa DNA na talaga ng tao, yung nalalanghap talaga natin na environmental pollution.
Right. Now, there's a lot of risk factors that our guests mentioned. When we return, let's talk about other diseases that are linked to lung cancer. Stay with us here on MedTalk Health Talk. You're watching CNN Philippines. Today, we're talking about lung cancer, the leading cause of cancer death in the world. Lung cancer is linked to a couple of diseases of the lungs, and while its symptoms often don't appear until its advanced stages, understanding the difference between pneumonia and lung cancer and COVID-19 and lung cancer can help you better recognize the condition. I'm Dr. Freddy Gomez. Welcome back to MedTalk Health Talk on CNN Philippines. Lung cancer is a group of diseases characterized by abnormal growths that start in your lungs. Now, Dr. Ralph, how does this compare with pneumonia? Before we answer that, first let's explain to our viewers what pneumonia is.
So I have to explain that pneumonia and lung cancer are two very, very different diseases of the lungs. No, they are both found in the lungs. They can have the same symptoms, but the cause of pneumonia is different from lung cancer. Lung cancer, when we explain it to our patients, bukol siya sa lungs. No, so matagal mag-form ng bukol sa lungs. Hindi siya nangyayari overnight. Unlike pneumonia, is when it's the acute infection, it is mabilisan yung paglabas niya in days, 2 weeks, you can have symptoms of pneumonia and if you're exposed to a disease, nagkakos ng pneumonia bacteria or virus or fungus, versus lung cancer that develops over years. No, so these are two very different diseases, but can actually behave or present the same way.
What Dr. Ralph mentioned, that these are very distinct diseases, but they can present in the same way. So let's give our viewers a clear idea on what constitutes pneumonia as opposed to a diagnosed case of lung cancer. Let's talk about first some of the warning signs of both. What similar symptoms would pneumonia present and someone with lung cancer?
Yung pneumonia kasi, nangyayari yun, kadalasan ang nararamdaman, lagnat, ubo, lema. Pag medyo may edad na, pwedeng hindi maglagnat, pwedeng nanghihina, walang ganang kumain, nagtutulog-tulog, pwedeng bumaba yung oxygen level pag malala yung pneumonia. At saka nangyayari yon sa loob ng ilang araw. Yung lung cancer naman, sa umpisa, pagka maliit pa lang siya, kadalasan wala siyang sintomas. Pero pagka nandun na siya sa stage na advanced na siya, lumaki na siya or kumalat na siya, doon siya magkakaroon ng sintomas na pwedeng ubo, pwedeng nahihirapang huminga, yung iba, pwedeng maglabas ng dugo sa plema.
Now, Dr. Ralph, I'd like to go naman kung what are the symptoms that is unique to that of someone with lung cancer.
So basically, since lung cancer develops over a long time, no, hindi siya over a few days, 2 weeks, some of these patients, nakakapansin sila na hinihingal at parang lagi silang pagod. Most of them, no, a lot of our patients with lung cancer na mamayat because yun nga, kinakain lahat ng cancer cells doon sa lungs nila yung energy. Kumbaga, instead no, pupunta sa ibang part ng katawan, kinakain na lang ng cancer cells yung energy. Bukol or meron din pong mga kulani sa leeg or mga bukol sa ibang part ng katawan, yun po yung unique sa lung cancer. No? Pagsakit ng ulo or pagsakit ng mga buto-buto is also unique to lung cancer, and that can say na baka advanced na yung lung cancer ng patient.
Now, Dr. Ralph, can symptoms of lung cancer mimic that of other diseases as well? Its early stages, can it be mistaken, say, for asthma or any allergic rhinitis or a persistent cough?
It is actually a very, very non-specific disease. Ang symptoms niya is actually hindi specific or kumbaga hindi siya very unique to lung cancer. Kaya other patients who are referred to as pulmonologists late na dumating, advanced stages na ng lung cancer. Importantly, in the early stages of lung cancer, asymptomatic talaga sila. Ibig sabihin, walang symptoms yung lung cancer. And most of these patients, sinwerte lang na nakikita yung kanilang mga bukol on routine x-rays, and then doon yung nag-work up. And then nakita na early stage lung cancer. So yun nga, early stage lung cancer, pwede talaga yun ma-diagnose with other diseases. And especially here sa Pilipinas, ang pinaka-common na napagkakamalan, akala ng lung cancer is TB. No? So akala ng most people, pwede kasing mag-diagnose ng lung cancer at TB, and they can present the same way. No? So akala ng ibang mga patients, TB yung nararamdaman nila kasi meron silang upo, lagnat. And it can also happen in lung cancer kasi. And some of them, unfortunately, tinitreat muna for tuberculosis, and unfortunately, hindi pala TB ang kanilang sakit.
So with that, a reminder to our viewers, kapag meron kayong nararamdaman simptomas, lalong-lalo na pagdating sa inyong baga, it is better na magpa-check up kayo sa inyong doktor, sa inyong pulmonologist sooner rather than later. Recent research has been done on the relationship between COVID-19 and lung cancer. Dr. Tin, could you please tell us more about the link between COVID-19 and that of lung cancer, if ever there is one?
Pagka nagkaroon ng COVID, mas mataas yung risk na magkaroon ng severe COVID. And at the same time kasi, pag sa mga pasyenteng may lung cancer, kadalasan sa kanila smokers. And pag smoker, kadalasan sa kanila merong mga ibang kasamang mga sakit. And yung mga sakit na yun yung pwedeng makadagdag sa pagpapababa ng defense system ng katawan.
Now, there are several treatments available for lung cancer depending on its type and how far it has progressed or how far it has spread. When we return, we'll discuss the options available and preventive steps to keep your lungs healthy. We want to be your partner for a lifetime of good health. Stay with us on CNN Philippines. I'm Dr. Freddy Gomez. This is Med Talk Health Talk, where your health comes first. Lung cancer is the most common form of cancer here at home. But emerging treatments today mean that many people can survive and recover from the disease, especially if detected early. Dr. Ralph, that's our key point today. We want to diagnose lung cancer early. So what are the ways in which lung cancer is diagnosed?
So basically, the first step usually that happens no detecting lung cancer is an imaging test. So an X-ray is the first usual step that is ginagawa para malaman or makita yung lung cancer. And then doon malalaman ho natin may suspicious na bukol na makikita sa lungs. And then the next step would actually be a better imaging, which is a CT scan of the lungs.
Early detection is key when it comes to cancer or for any disease for that matter. Today, there are several treatments available for lung cancer depending on the type of cancer and how far it has spread. Dr. Ralph, can you tell us more about some of the treatment options available?
So really, the treatment of lung cancer depends on the stage. No? So there are very, very lucky people na nadetect yung kanilang lung cancer at a very early stage, or stage 1 or stage 2. Ang treatment ho dyan, kapag ganyan ho ka-early na stage, is we want to get rid of that bukol as soon as possible and as completely as possible. So ang ginagawa ho natin sa mga ganon is a surgical removal, usually of the entire part of that lung affected with that cancer. Sometimes the lung cancer has spread towards the lymph nodes or sa mga kulani sa loob ng chest. And yun po, kapag gano'n na ang staging natin, it's a combination of chemotherapy and radiation therapy naman.
Now, ultimately, there are things that we can do in our day-to-day to prevent the disease altogether. Sometimes we take our lungs for granted, but it plays a vital role in keeping us alive and well. Now, my next question is, what are the tried and tested ways to keep our lungs healthy? Dr. Ralph, can you answer that, please?
Okay. So basically, the lungs are unfortunately exposed to really a lot of exposure, no? Kasi siya yung nag-inhale ng hangin. So, ang hangin na natin, hindi naman siya ganun kalinis, and some of the microbial na doon. So, wearing a mask, no, is not only helpful right now for keeping or avoiding our risk of inhaling those pollutants, but also it's very, very helpful na rin in inhaling all those microorganisms na pwede talaga mag-cause ng infection. Usong-uso ngayon yung COVID, and uso na rin ngayon yung ibang lung diseases like pneumonia and other mga sakit sa lungs, no? So a mask is one of the most important and basic ways to keep our lungs healthy. And of course, healthy living, exercise, proper diet. We cannot overemphasize that the role of that, no, in keeping our lungs healthy, because our lungs are also part of the whole metabolism of the body. So antioxidants and the healthy diet can provide us with antioxidants and all these healthy substances that can keep on fighting all these infections and all these lung insults that we have. So basically, yun lang po yung pinaka-tested talaga kapag sa lungs natin.
Yes, and we'd always like to stress that eating really healthy and exercising regularly can improve your overall well-being. So incorporate these simple habits as much as you can. And with that, I'd like to thank interventional pulmonologist Dr. Ralph L.V. Villalobos and Health Justice Representative Dr. Christine Chavez for sharing with us your valuable insights. We appreciate you making the time to be here. On Med Talk Health Talk, we bring you the knowledge and care that you need. I'm Dr. Freddy Gomez, and we'll see you again next time.